So let's try to do this a bit different because I believe some of you have been sitting for a while now. It is very hot. I think we all acknowledge that. It's right after lunch, so we're going to try to not make you go into your power nap. So I would like to do something before we get started. If you hear me, clap once. If you hear me, clap twice. If you hear me, clap 3 times. Okay, so Dr. Azar probably knows what I'm doing. We do this a lot when we engage with large-scale improvement projects with large-scale teams. And as you can imagine, it's not easy to keep large-scale audiences engaged, and that's why we do this type of exercises. So, what I will start our panel, and be aware that Dr. Cather, which is our CEO and president for the Institute of Health Improvement. Now, may I know how many of you are clinicians in this room? Put your hands up if you're a clinician. Not many. Are you shy or? I'm not going to ask difficult questions, I promise. So, can I have somebody telling me, how do we measure the heart rate of a patient? What is the physiological function within our body that gives us the measurement of heart rate?
Yeah, indeed.
Heart, the pulse, right? That's the first thing we learn in medical and nursing school, to measure pulse. Now, I like to think that the same way we measure the pulse to identify a patient's heart rate, we also have to measure how well or how bad our health systems care are. And we do that through measuring what we call value. And to measure value, there are different strategies, and the one we're going to talk about today with our panelists is a strategy that it's called large-scale improvement health projects. And fortunately, we have a great global entity that has given us resources for us to use, the Institute for Healthcare Improvement, where they have supported either internationally and nationally how to deploy this large-scale projects. And with that, I will start my first question to some of our guests. And the first question will be just to give us some insight of what we're talking about. I will direct my question to Dr. Azar and Dr. Sodzi to give us an overview of an example of a large-scale improvement project that you have either participated or led. So Dr. Azar or Dr. Sodzi, by all means.
Well, thank you very much, and I'm hoping that you can hear me loud and clear. So I work for the Institute for Healthcare Improvement, which is global, and we try to achieve change at a large health system level, at the population level. So we've done a number of projects with the aim of improving health outcomes. So I can immediately think of work that we've done in the region, okay, with the aim of improving quality and maintaining cost. And because you are talking about large scale, I can immediately cite over 100 facilities that have taken up the high impact changes that have brought about, the desired effect. In Africa, we've also done quite a number of work. I know in Ghana, we scaled up high impact interventions for improving child health, reducing under 5 deaths by over 35% in 200 public hospitals. And similarly, in Mozambique, we reduced under 5 maternal mortality by 30% in over 100 facilities in 23 districts. So quite a lot of work going on in the space using a very systematic methodology and approach.
Thank you. It's actually very interesting because I look at Dr. Sodzi and I feel like I'm looking to a star, because this morning I was preparing the session and I came across a very well-known video where Dr. Sodzi is actually talking about this massive project, and therefore is an honor to actually have the person that actually moved with those projects to achieve the outcomes Dr. Sozi achieved. So thank you. Dr. Azar?
Yeah, thanks very much, Sophia. So I think if I take myself back to the first large-scale improvement work that I was involved in, so I'm from Scotland, I'm a family physician from Scotland, and this was in 2008 when Scotland, the NHS in Scotland started a program across the whole of Scotland, which is a relatively small country with a population of 5 million, but was focused on patient safety. And this started because there were a number of deaths in hospitals, mainly related to Clostridium difficile infection, but it expanded into a safety program across the whole of the country aimed at reducing hospital harm from within the hospital. So hospital-acquired infections, pressure ulcers, surgical site infections, so a wide range of harm that happens from within the hospital. And that program was very successful. It had a reduction of mortality over a course of, I think, 5 years, 26% reduction in mortality, significant reduction in surgical site infections. So really very successful. And then Scotland took that example, took the capability that they developed and applied that to different areas. So primary care, to maternity care, even outside healthcare, to young children and young peoples. So I think that was probably one of a very strong example globally of how you can spread improvement across a large scale, which in this case was a country.
Thank you. I would like to perhaps ask the crowd control colleagues if there is any chance that we could have less noise on the back. So as you could see from Dr. Azar and Dr. Sozi's examples, if you can achieve good outcomes in your unit, imagine how much you can achieve when you scale up. So the outcomes will potentially exponentially be improved as well. And these are two examples of success stories. So now I would pass my attention to Dr. Yasser, and I'd like to ask Dr. Yasser, within the Saudi Arabia's Vision 2030 context, what have been key successes from your perspective and learnings from large-scale projects that you have been personally involved that can have an impact within the whole transformation?
Thank you, Sophia, for the question. So I work for the Ministry of Defense Health Services, which is the second largest governmental healthcare provider here in the kingdom. And we operate more than 20 hospitals across the country. Now, over the past decade, and also as part of the healthcare transformation in the kingdom, we've invested a lot in trying to improve healthcare outcomes in the kingdom. We've implemented a number of quality improvement collaboratives, around probably 20. And we've replicated some of the things that are being done internationally, like reducing maternal mortality, reducing waiting times in emergency departments. So all of that is feasible and it can be done. But what we're seeing now in the country is that a lot of the improvement effort that is happening in silos. So you find the Ministry of Health doing their improvement work, you find the National Guard doing their improvement work, and you find the private sector doing the improvement work. So I think there's a big gap, or let's say a big area for improvement to get everybody together under one umbrella so that they can collaborate with each other and they can learn from each other, right? So I think that's probably an area that requires attention. Also, I think we need to incentivize the system more for improvement. I think moving more into a value-based payment model,
Yes.
yeah, that is going to incentivize the system and drive it and catalyze a lot of efforts into achieving Vision 2030.
Thank you. Now, Dr. Yassa touched a point that is very crucial when we develop large-scale improvement projects. And the point is of breaking the silos and making sure that whatever successes you find within your unit, within your hospital, within your institution, that this gets scaled into the other units, the other hospitals, the other entities. And this is very important because then the impact will, in parallel, exponentially expand as well. Now, personally, being part of large-scale improvement projects in collaboration with Dr. Yasser, Dr. Azhar, Ms. Eman, and other colleagues, there is something very particular in Saudi that I'd like to explore with Ms. Eman, which is how have cultural and local factors within Saudi shaped the way we design and we implement the large-scale health projects in Saudi?
Thank you very much, Sophia,
Yes, go ahead.
for the question. Well, as you have mentioned, there's definitely something very significant when it comes to embarking quality improvement projects in Saudi Arabia. Just to give a scale about that, about 3 years ago in 2021, we have started or we have done quality improvement projects with over 85 projects throughout the country. And from then, 97% have completed and have shown a significant improvement of all the 85 projects. This year, as yourself, Dr. Azhar, are very aware of, since January until now, we have also a different project in Saudi. And of all the projects we have and all the teams, all projects have either showed a significant improvement, or for the project who just joined back in May, have showed that there is a improvement that was achieved, and now they're working on sustaining that improvement. One for sure would be asking why is that happening in Saudi? It's not the norm if you go to international institutions or international healthcare systems that are trying to do quality improvement. And to answer that, from talking to the teams all over the years, I could tell you one main thing that I have personally noticed, which is the teams know by heart that the healthcare transformation is there. They also know this is the biggest healthcare transformation in the world, and they know that they are part of a very big project that they're embarking. And this is why their main motivation is purely passion. They're just passionate for the cause, and they're already achieving the improvement.
Thank you. That is very interesting. While we develop the large-scale projects in Saudi, and when I say Saudi, we mean projects across the country working together to achieve one outcome, so you can imagine the magnitude of this project. It's very common that colleagues that come from outside, they all come to the conclusion that there's something special about the Saudi context that really allows for these projects to take shape and to really show a level of engagement and commitment from the staff that may not be so evident in other countries that we've all been worked before. So the cultural factors, I think it is very important, and perhaps to explore further on what can we improve to enable these projects to be successful. Now, I would like to ask Dr. Azhar, so from the experience, and because you've run projects internationally and also in Saudi, I would like to ask you how the international partnerships that Saudi and the Saudi health sector can establish, how can they be enablers to let's say, to disseminate the concept of large improvement or large-scale improvement projects?
Yes, maybe I'll use an example. So at Center for National Health Insurance, CNHI, we have, over the last 9 to 10 months, we've been doing some work around value improvement or focus primarily on efficiency, actually. And we did this with 22 teams across a number of clusters, but also Ministry of Health clusters, but also private sector. We partnered with our colleagues in Health Holding Company to do this work. And over the course of 10 months, we've shown some really significant improvements within things like length of stay. So we showed a 30% reduction in length of stay, 25% reduction in outpatient no-shows, 10% improvement in patient satisfaction measured by Press Ganey. And in terms of cost saving, there was something like 12 million cost saving. Some of that was cost avoidance, and some of that was, about 5 million of that was actual cost saving, primarily around drug use. And in terms of how did we set that project up, so first of all, we looked towards methodologies from the IHI, from the Institute for Healthcare Improvement. We used the Breakthrough Series collaborative methodology as an approach to running the program, but we also used a tested IHI innovation approach around value improvement, and this was work that was done in Scotland, it was been done in Qatar, it's been done in New York as well. So we used methodologies that had been tried and tested, and we tweaked them slightly. So in fact, we have conversations with Dr. Yasser, who's done some magnificent work in his system, and what were the enablers, and one of the things was actually coming up with some change packages, or some guidance and support around what are the focus areas that could have a high impact. We also put in place regular coaching, so we had weekly coaching calls for the teams that were working on those projects, and we engaged with faculty that had done this work previously. So we had international faculty from primarily from the UK, but these are people that had worked with IHI before as well. But of course, I think one of the important factors here is that there was already a significant improvement capability within those teams and within the providers. So they had already been doing some improvement work, albeit relatively small, and maybe small projects at the unit level. So that was, I think, one of the enablers that allowed us to move very quickly and rapidly. So there was some existing capability, and then trying to build on that existing capability, making sure there's strong leadership engagement. At the same time, making sure that we have tried and tested approaches and that coaching support. So I think those were some of the factors that were successful for us, but we did rely on international success and trying to build on that international success.
Thank you, Dr. Azar. Now, before I go to my next question, I do have a question. So I asked earlier who was a clinician, and barely some people did. So who's in a sector that is not healthcare? Or within healthcare, but is not in a hospital, is not a clinician? How many people? So those of you that are neither, where are you then? Okay, the reason why I asked this question is because my next question will be for Dr. Kader, and I'm interested in knowing how important do you believe that cross-sector collaboration, so not just physicians for physicians or nurses for nurses, but how does cross-sector collaborations can help drive the success of large-scale projects, whether in Saudi or outside of Saudi?
There we are. Well, first of all, let me just say thank you for having us and having me on the panel, and apologies for making a side entrance here, but really grateful to all of you, and thank you to my co-panelists here as well. There's no question that healthcare has a lot to learn from other industries. Other industries, so many things in our life actually have scaled much more successfully than healthcare. If you think about the distribution system for the bottled water that we're sitting here on the table, that distribution system is scaled nationally, internationally, If you think about aviation, the planes and trains and buses and cars that we all took to get here today, all of those things are scaled at a regional or national or even international scale. So understanding how to scale is a lesson that healthcare needs to learn from other industries. We need to apply that knowledge to healthcare. So it's, you can't equate what happens in the automotive industry or in the airline industry or in the bottled water industry to healthcare, because what we do in the exam room, what we do in the operating room, what we do in the emergency room is a very different kind of interaction than the kind of interaction we have in an aircraft or in a car or when we're buying a bottle of water. These are much more intimate, much more personal interactions with a system that's designed to support our care. But there are things we can learn from those other channels, from supply chains, from major industries that have actually successfully scaled things. And one of the most important things that I've learned from studying other industries is that they actively learn from other industries. So we have to get much better at this in healthcare in order to get to the kind of results that we want at scale of our whole systems.
Sure. And how do you, so you really touched a very interesting point. Coming from a patient safety background, the adoption of other industry strategies is very, very important, such as you mentioned, aviation, even gas and oil, nuclear power, and so forth.
Yeah.
So is there anything particular within these industries that we can do better within the health sector that can be related to a large-scale intervention?
I think what these other industries do very successfully is that they take a product or the service and they spread it at scale in mass, but they also customize it to the individual. So they create an experience of, being on an airplane or buying shoes or finding something that you enjoy in a soft drink that you enjoy. They create choice for the user, and they design the experience of that interaction in a way that fits you as the user. And in our case, in healthcare, it's the clinicians and the patients. So I think this idea that we've learned from other industries at IHI is the idea of what's known as mass customization. So they create scale, that's the mass, but they also include within it the idea of tailored experiences to the individual. And I think that's the lesson that we have to learn in healthcare, is how do we create scale, mass, but also how do we create an experience of healthcare that feels very personal and very relatable and very much designed for me, what matters to me, what is important to me, and what I need as a patient or a family member.
Indeed. And taking on that note, I'll just open the question for the other colleagues. So what is the role of the patient, that the patient perspective play in these large-scale projects? Can you just share some examples where we have actually included that perspective, and how does that perspective tailored how we design large-scale improvement projects? I'll give the floor. Iman, do you want to go first?
With pleasure.
Is that working?
With pleasure.
Yes.
I'll give an example of one of the most successful projects that I've seen back in 2022. The representation of patient representation actually was part of the project, in regards of they had a patient himself who was part of the pathway that was improved. Each person in the team had a family member, or that person themselves had that case, which was back then diabetes. And that led to a very successful improvement, because everybody literally had their heart in it. That's what really shows you how important it is to have patient representation in healthcare improvement.
So, thank you very much.
Dr.
There's something very interesting that the founder of IHI, Don Berwick, says, that there are three things that patients want when they come to see you in the hospital. They say, help me, do not harm me, and be nice to me. These are the three things. And the question is whether in your attempt to help the patient, you're going to do things to the patient or you're going to do things with the patient. And I think increasingly the realization is that you're better off doing things with the patient. Although I see, as I move around, that sometimes even clinicians struggle because there's just this power asymmetry, knowledge asymmetry. You know so much, and sometimes you even doubt whether the patient has the right to question or to ask, for more information. But the data is very clear. When we have done collaboratives and we have brought patients into the collaborative, sometimes even made patients part of the quality teams, they contribute to the design of the intervention. And you find out that you get better outcomes. Even in dispensing medication, when you take the time to engage them at the level of their understanding, compliance is better. So there are structures that people are now building into the health systems. Being part of the quality teams, being part of patient and family advisory councils is also one. And in some intervention that is being tested in some countries, they have what they call community scorecards, where they would go into communities, have these focus group discussions, and harness feedback as to the quality of care that they are receiving and use it for ongoing improvement. And these make quite some dramatic results. Thank you.
Thank you. Dr. Yasser?
Well, to be honest, and I think that the healthcare sector is lagging behind compared to other consumer-based sectors in involving patients and including patients as part of the design of our processes. Most of our healthcare organizations, by the way, we have legacy processes that we have inherited for decades. And when we do the improvement and when we redesign the process, most of the time, we don't include patients, or we redesign the process based on outcomes that we think are important to us. Yes, I think including patients is critical as part of improvement work. Is it happening enough? No, it's not happening enough. I think we should do it more, and also we should be more serious about it, rather than just bringing in a patient or a family member as part of the improvement team just to tick a box that, well, we have a patient. I think we need to make them the cornerstone of redesigning our processes. I think we should be doing more in that regard.
I agree. Dr. Azhar?
Yeah, I think I absolutely agree with what Dr. Yasser said. So even reflecting on our own practice, we've been doing some work around how do we measure quality within the system, and how do we incentivize quality within the system? What are the different things that we would look at? And we did actually involve patients. We had patient advocates, and we did some focus groups with those patients as well. But reflecting on our own practice, we did that towards the end, rather than actually bringing them in from the start and from the get-go of the conversation. So absolutely, I think this is a big area that there's a gap, that patients need to be involved from early on as possible. And actually, you need, as they say, expert patients who can really bring in the experience that they have as patients to shape the care, because ultimately that's what we're trying to do, is improve the care. But really, and this goes to about them being the experts to really guide the work and what we should prioritize as well.
Yes, indeed. And every time we speak about the involvement of patients within the design of our healthcare systems, I always go back to, like Dr. Kether was mentioning about other industries. It would be like designing an iPhone without having us involved in the iPhone design. Probably Apple wouldn't be where they are today. And whenever we design, how many of us have been involved in designing a new pathway, a new patient journey? It's very interesting when we design patient journeys through a given service, do we really bring the patient to tell us how does the journey should look like? And as we involve patients, and going back to Dr. Sozi's presentation that I saw this morning, it was very evident how whenever we bring communities and the patients and society to help us scale-up projects, the chances of success are much higher, because then we can step back as clinicians and our end users will take over and will ensure that the projects continue. So the patient perspective in the projects that we design on either small scale and then on the large scale, they definitely should have the patient perspective. And as we all agree, this is an area where health industry has some areas to learn from other industries in this regard. So I'm just mindful of the time, and Dr. Kether, you do have a great presentation to show us. Just want to ask a last point. So for all of us that have taken part of large-scale improvement projects, what would be your advice for anyone within the audience or those that will be listening to our panel later? What would be your advice, whether locally or internationally, to anyone that is thinking to scale up a project or initiate a small project and then scale it up?
Well, for me, thank you for this question. It's, in my opinion and in our experience at IHI, we've had a lot of success at creating local improvement initiatives within a hospital or a health system. The question is always, how do you get to full scale? How do you get to the entire hospital? How do you get to the entire cluster, the entire region, the entire country? And when I think about that, you have to have three important ingredients. You have to have demonstration of success at the level of the microsystem. You have to have those initial findings that show you that the improvement that you've created can create results at scale. You have to have the will and buy-in from your leadership, and that comes from either economic incentives, it comes from regulatory pressure, it comes from the opportunity to do something really dramatic, the idea of a bold, ambitious aim. You have to have will, you have to have good ideas that are evidence-based, that lead to improvement, and then you have to have, really importantly, a systematic approach to achieving scale. Whether it's a learning collaborative that Azar and others have mentioned, whether it's a campaign, whether it's another mechanism of some kind, but you need some kind of mechanism for going from local to cluster, to institutional, to cluster, to region, to national. And that's the three elements: will for change with leadership, better ideas that are demonstrating, that are creating results that matter to people, and then a systematic approach to scale.
Thank you. Anyone would like to give a tip or an advice? Dr. Sadzi?
Maybe what I would add to what Keda has said is that I'll build on your example of the iPhone. There is nobody who studies the manual of the iPhone before they use it. It's designed in such a way that intuitively you are able to use it. And as I apply it to the large-scale initiatives, one needs to document what has worked and how it has worked, and describe it in such a simple way that when you scale it up, people can take it and work with it, because you won't always be there to do the coaching and all of that. So the change packages, to design it in a very simple way without overcomplicating it with jargons.
Yes.
So that the health workers and the leaders can work with it. That's really the advice that I would give.
Dr. Yasser, would you like to?
I think from my experience, you want to go ahead? From my experience, I would probably give two important advices for large-scale improvement work. First one is invest in people. Invest in your team. You need to invest in your team. You need to build capability and capacity in them, because they are the ones that are going to do the actual improvement work. They are the ones that are going to carry the torch. So you need to invest a lot of them. And we have a very successful example, our Flow Collaborative. So we sent a number of our champions to the IHI to attend the IHI Flow workshop. And they came into our system, and they did a lot of improvements. So invest in your team, and ensure to incentivize them. And remember that simple encouragement goes a long way, and empowering them. My second advice is to build up on what Susie mentioned, is the change package, standardization. If you are going to implement any improvement work across multiple sites, you need to make sure that the change package is standardized. For instance, if you want to improve VTE prophylaxis, make sure that you have the guideline well written, that you have the form prepared, and it's evidence based. That will help a lot in implementing the improvement work.
Indeed, correct. Mr. Iman?
Well, the first thing, honestly, not to shy away from planning and planning ahead of time before embarking on the project itself. Planning by, first of all, selecting the initiative that need to be improved. And this will help in getting the buy-in of the teams, because if you select the right initiative, it will build what Dr. Khidr mentioned of having people seeing it on a smaller scale and then spreading it from there. Second of all, you have to foster an ecosystem that really nourish the improvement project to prosper. Third of all, you also need to have motivation, because quality improvement projects would take from a year and a half to 2 years for also the learning basic part of it. And because of that, people will not go through all that time without the proper motivation. So you have to find a way to motivate them. And the fourth thing I would mention is to build a networking among the teams. This will help you to step back when needed and not be able to micromanage it, and the teams will be supporting each other through this networking to go further with the projects.
Thank you, Dr. Azhar.
Yeah, so I think, I think one of the key things for me is obviously you can scale up, but actually how do you then sustain a large scale as well? And I think this is about really thinking about how do you move away from an initiative or a project, and we talk about improvement projects, to actually, this is the way we do things. This is how we actually apply the tools of improvement on a daily basis. So when we come to our work, we're always thinking about the work we do, but also how do we improve the work we do. And I think that's about creating a system, a management system, if you like. And that's some of the work we did around efficiency. We used some of the IHI approaches. So, for example, are you looking at your data regularly? Do you have a mechanism to update your data on a weekly basis so that you're looking at that frequently? How do you share your data in a transparent way where everybody can see the improvement work that's happening? How do you ensure there's mechanisms to escalate with leaders if there's not improvement or if there's obstacles? How do you actually bring people together so the teams would have weekly huddles? So you create a system around these different approaches, which are practical approaches, and this becomes, rather than an initiative or a project, becomes an actual approach, a management approach that then can be deployed in whatever area that you want to improve, whether it's on efficiency, whether it's on safety issues, experience, the staff engagement. So you can see that being applied across at the microsystem level. And then you can actually then cascade that up to the leadership level as well, where you can apply some of these tools and mechanisms as well.
Thank you. Well, from my side, I would like just to add one tip that has proven to be, let's say, the beginning and the end of the thread of any project really, but especially for large scale, which is ensuring that we have the leadership support. And we've learned, and I'm not sure we're different, that we need to have the leadership support from the beginning and throughout the project. We've been very proud to say that the projects that we've been heading, they do have leadership support, and it's obvious and very evident to us that the teams that have a leadership that is more present has higher chances of success compared to those that don't. So if for anyone that is wanting to scale up an improvement project or any project, leadership support from the beginning is key, and then throughout the project as well. So get your leaders involved right from the beginning to ensure success. So I don't know, well, I was going to say we have time, we don't have time. I just want to appreciate our colleagues within the panel for taking part of the session. Dr. Kader, I believe you have a presentation for us now, and we'll be happy to take part on that.
Thank
Thank you so much. Thank you for the audience for your attention.